This presentation is designed to help cleaners and cleaning staff to use good practices that will help both us personally and our clients. While some people may be seriously concerned with the recent virus we're experiencing, what is covered in this learning bite is based on good habits that have helped cleaners who had to deal with other previous outbreaks of viruses or infections. We will look at 3 areas. 1. Infections can be controlled. 2. Using good personal habits. 3. Cleaning in ways to prevent the spread of infections. Infections can be controlled. It is important that we understand that infections can be controlled. Each day we have germs around us and on us. Our bodies, when healthy, can often defend itself so we don't become seriously sick. So when we use good personal habits, we are actually helping us avoid becoming ill. When we use good cleaning habits, we do much to prevent the spread of infections. So rather than panicking, we can take steps to protect ourselves and those we work around, as well as helping our own families. Viruses are spread through 3 main ways. 1. Through droplets when coughing, sneezing, or even talking. A person who coughs or sneezes without covering their mouth or nose can spread virus germs onto other people or surfaces. Even when talking, people may spray droplets as they speak. 2. Human contact. Shaking hands or making direct contact with another person who is sick can infect others. 3. Contaminated surfaces. If a virus has been spread onto a surface, others who make contact with this surface may then unknowingly pick up the virus. Using good personal habits. As cleaners, we are often exposed to surfaces or waste that can be contaminated or carry germs. So here are some important instructions that will help you. 1. Wash your hands regularly. Even if wearing gloves, we still need to wash our hands with soap and water after removing our gloves. When we do wash our hands, we need to make sure we use soap. Try to make a lather with the soap and water. Rub both hands and fingers as you wash your hands. Make it a habit to wash correctly for at least 20 seconds. 2. Wear suitable personal protective equipment. Disposable gloves are one important protective measure. Since we'll be picking up, wiping, or handling many things, we will need to also change them regularly with a clean pair of gloves. The more infectious an area is, or when dealing with virus outbreaks, may require us to change gloves more frequently. 3. Masks may also be needed. Generally, when we are around a lot of people, a correct mask is important. If we are cleaning mainly out of hours, there may not be a need to wear a P2 mask. However, if we are aware or have been told to wear a mask because of an imminent threat of being infected, we should follow instructions and wear one. A suitable mask must be a P2 rated mask. If we receive instructions from the authorities that we must wear a mask at all times, please follow these instructions. 4. Avoid touching your face. We may have a bad habit of touching parts of our face while cleaning, and this may lead to us becoming infected. It is not just touching our mouth we must avoid, but this also includes our nose, eyes, and any open wounds or sores. Check yourself if you have this habit, and learn to minimize touching parts of your face unless you have clean hands. 5. Use a hand sanitizer. This is also a good practice to use hand sanitizers. If you have washed your hands, ensure they are dry before applying a sanitizer. Hand sanitizers can be used regularly during the day and can help control infections. 6. prevent spreading germs, and avoid contact with others. If we do need to sneeze or cough, use a tissue or your hand to prevent the spread of droplets. Immediately wash your hands after disposing any used tissue or to clean your hands. If while you are cleaning you need to sneeze or cough, use your bent arm and cough or sneeze into the fold of your arm to prevent the spread of droplets. Avoid coughing or sneezing into the cleaning gloves you are wearing. If you do need to work near other people, keep a distance between you and them of at least 1 meter or more. Avoid shaking hands, touching, or sharing items with other people. Cleaning to prevent the spread of infections. The next points will help so we can use good methods when cleaning. High-touch surfaces. It is important we understand what these are. High-touch surfaces are areas that have a lot or regular human contact. As mentioned earlier, viruses are also spread on surfaces that have been touched by someone who is sick. So what are some examples of surfaces that are high-touch? Let's look at some examples. In toilets, these can include door handles or push plates, push buttons on toilets, taps, paper dispensers, handrails. In classrooms or offices, this may include desks or tables, light switches, telephones, door handles or push plates, back of chairs. In kitchens, these may include benches, dining tables, microwave and fridge handles or control buttons, cupboard door handles, and generally places where people may rest or lean on a surface with their hands. Check carefully what is in a room you're about to start cleaning and look for the surfaces people will most likely make contact with. Then use a good disinfectant, like Virex, a hospital-grade disinfectant, to wipe these high-touch surfaces. Dispose contaminated waste immediately. As discussed earlier, wearing gloves while cleaning or handling waste is important. So if you are picking up used tissues, food scraps or other waste, ensure you place these immediately into the garbage bag. If picking up tissues or items personally used by a person, you can use a smaller garbage bag to pick up and place the contaminated waste directly into the bag. Hold the bag on the outside and use the inside of the bag to pick up and drop the items into the garbage bag. This helps minimize our gloves being directly in contact with things like used tissues, band-aids, or other items soiled by people. Keep used or dirty microfiber cloths separately. As you clean, make sure used microfiber cloths are kept separate to your clean cloths. Also avoid mixing the color-coded cloths, as this may lead to cross-contamination. Having separate compartments for clean cloths and those being used should be normal practice. A bag for washing or laundering all dirty microfiber cloths can be used to keep together all cloths to be washed. Avoid contaminating clean surfaces. As you clean, make sure you do not later accidentally place a dirty cloth onto or touch a surface with soiled gloves. Always clean so that your final clean of a room does not mean a dirty cloth or other used equipment makes contact with cleaned and disinfected surfaces. Clean first, disinfect next. If a room has been badly soiled by people who are ill, you must first remove any spills and contaminated waste, and then clean the surfaces. Disposable paper can be used to remove solids, but place these straight into garbage bags, or clinical waste bag if serious contamination. After it has been cleaned thoroughly, you can wipe surfaces with a disinfectant. Badly soiled surfaces cannot be made safe just by using a disinfectant. First, remove the contaminated soiling, rinse, dry surface, and then disinfect the clean surface. So in review, here are some of the key points covered. Good personal habits include washing your hands regularly, wearing personal protective equipment like gloves and, if required, a P2 mask. Avoid touching your face while cleaning. Use hand sanitizers during the day. If coughing or sneezing, stop the spread of droplets. Keep a distance from others. For good cleaning habits to prevent spreading germs, this includes identifying high-touch areas, remove contaminated waste immediately into garbage bags, keep dirty or used microfiber cloths separate to clean cloths, avoid contaminating again clean surfaces. If a serious infection cleanup is required, remove the soiling, clean the area, rinse the surfaces, and disinfect the clean surfaces. Lastly, remember that by maintaining a good diet, exercise and rest, you can do much to keep yourself healthy and to help your body fight illness. We hope this important learning bite will help you to properly care for the clients we clean for and to benefit you too. If you need to, you can replay this video to hear these points again.